Now we will see the structures over here. So basically this is a scapula, lateral side, this is a midline side. Okay, and then we put a muscles. We'll see a various muscles. Now you can see this is a trapezius. This is the upper part of the trapezius. This one is the lower part of the trapezius. Now once we see, uh, let's remove the trapezius. So when we remove the trapezius, you can see this is the scapula and this is the levator scapulae muscle. You can see it is directed superiorly and medially. This is a levator scapulae muscle. So this is a levator scapulae muscle and this is a rhomboid minor muscle and lower one is rhomboid major muscle. So 5-in-1 block, our area of interest is trapezius, levator scapulae, rhomboid minor muscles. Now we have put the vessels there and we have put the nerves there. So you can see this is a trapezius. Once we remove the trapezius, you can see that this is a branch of the spinal accessory nerve. So in between the trapezius and the levator scapulae and the rhomboid minor, you will see the accessory nerve, spinal accessory nerve. You have seen that this is the spinal accessory nerve. Okay. So now let's go to the plane below the the triangle between the levator scapula and the rhomboid minor, and you can see that very nicely. You can see that this is a dorsal scapular nerve. This is the dorsal scapular artery. So this is our target area where will be seen. You can see in between the levator scapula and rhomboid minor, in that triangle you can see that this is in vasculature where we'll be injecting the 5-in-1 block. This is in scapula, this is a midline, and we are putting the probe onto the medial border of the scapula, directing it little superomedially, and then we'll see the picture now. So now when we are scanning, I have directed my probe near superomedially, and you can see different structures. Freeze the image, please. So we can see different structures. This is scapular border. This whole is a trapezius. This muscle you can see is a levator scapulae, and this is a rhomboid minor. Here you can see a vessel, a nice vessel over here, and we'll put the color and see the neurovascular bundle over there. Stop. So this is a dorsal scapular artery. You can see the pulsations of the dorsal scapular artery into the area between the levator scapulae and the rhomboid minor. Now, stop. Now you can see the, freeze the image. Now you can see the trapezius nicely, and you can see in between the trapezius and this is rhomboid. You can see a small gap over here, and this is the area of the accessory, and this is a vessel. Once structures are identified, I'll be turning my probe and going inferiorly. So this is superior, this is inferior. I'll show it onto the scan.
Start.
Now you can see the various structure. Initially it is trapezius, then you can see the part of levator scapula, and you can see the dorsal scapular artery. We'll put a color over there. Can you nicely see the vessel there? Okay. So we have to avoid that vessel. And you can see that the rib is also very close over there. Okay, just above the below the rib, there is a chance that you might puncture the pleura if you go blindly significantly inside. So be careful while injecting. Now, so how we can inject is what we find at our clinic is, see, we are on to the middle border of scapula, trapezius, levator scapulae, rhomboid minor, and we can easily see all this structure over there. So we'll go from medial to the lateral, or we can come from, we find that this is the easiest approach at our clinic, in plane approach, and I'll show you again onto the screen that how we should be applying. So once we have identified the structures, medial side, lateral side, trapezius, scapula, levator scapulae, rhomboid minor, dorsal scapular artery. So we had two planes, one in between the trapezius and the just below the trapezius. So we'll inject over here for the spinal accessory, and secondly here will be a neurovascular bundle. So our needle will come from medial to lateral side. We'll inject it into this plane, and again we'll inject into this plane, avoiding injury to the artery. So this is called as 5 in 1 block, because there will be 3 muscles we are targeting. One is trapezius, levator scapulae, rhomboid minor. There will be 2 nerves. One is spinal accessory, other is dorsal scapular nerve. So 1, 2, 3 muscles and the 2 nerves. And our needle will come from this side. We'll inject over here, and then we'll inject over here. This is this will give a very good result to the patients with the spasm.